Hi, my name is Natalia Jimenez, and today I'm going to tell you something about oral surgery. That is because I'm studying dentistry and I would like to share with you something about my favorite subject. So, I'm going to talk you about what surgery is. Surgery is a branch of dentistry that includes diagnosis, surgery, and treatments related to a wide spectrum of diseases, injuries, and aesthetic aspects of the mouth, teeth, face, head, and neck. For that reason, surgery has many objectives, but I'm going to talk you about the main objectives of this branch of dentistry. The first one is ease the pain. As you know, patients used to come to appointments in order to solve their pain. The second objective of oral surgery is adaptation of prostheses, especially in those patients who has lost their teeth. The third objective is improve chewing function, and the fourth is eliminate infections. In order to achieve those objectives, there are many procedures like dental extraction, for example, if there is dental caries, precancerous injuries, prosthetic surgery, and implants. But if you want to make some of them procedures, you have to take into account some important requirements. For example, the first one is make the patient's medical history as complete as you can. So you have to ask to the patient if she or he has an important disease or something like that. The second requirement is examine the oral cavity in detail in order to establish a correct diagnosis. The third requirement is make use of diagnostic aids such as X-rays, photos, among others. And the last one is interdisciplinary work with the other branches of dentistry. So now I'm going to give you some important tips before to operate. The first one is to sterilize the required instruments and get the surgical fields, such as gloves, caps, lab coats, and others. The second is asepsis and antisepsis. For example, you have to wash your hands during 10 to 15 minutes, and you have to clean around the patient's mouth. Third is select the appropriate anesthesia technique. So this is in order to avoid pain to the patient. After this, you have to explain the procedure to the patient. Now I'm going to show you some instruments that you can use during the procedures. Some of them are carpal syringe, that is used for anesthesia, basic instrumental in order to see better the mouth, the teeth, and anything. The third is peristotum. The fourth is Minnesota's separator, surgery dental drills, dissection forceps, and mosquito tweezers, tissue scissors, shooter scissors, suction cannula, needle carriers, and elevators and forceps. Elevators and forceps are used in dental extraction, but the other instruments that I told you are used in almost everything procedures of dental surgery. But as you can imagine, there are some complications that could occur during the procedures. They could be surgical or post-surgical complications. Surgical complications could be root fractures, instruments fracture, tissue laceration, jaw fracture, tuberosity fracture, displacement of fragments, hemorrhage, hematoma, and adjacent teeth fracture. And post-surgical complications could be alveolitis, hemorrhage, ecchymosis, cellulitis, abscess, and pericarditis. As you can see, many complications can occur during a surgery, but that doesn't mean that one of them must always happen during that procedures, because that depends on the surgeon's experience, skill, and knowledge, but also on the anatomy and physiology of the patient. Finally, I'm going to talk you about my personal experience. Surgery is an important branch of dentistry, but also is something that requires a lot of knowledge and experience in order to achieve the expected result and avoid complication as much as you can. Despite of this, it couldn't mean that you won't have an adverse event in any procedure. In oral surgery, you must study as if you were studying. I have learned much about surgery because I love it since first moment that I assisted one procedure in my faculty. Since that moment, I started to assist any surgery without matter hour or day. I like to take advantage of those opportunities for learning and take it into account for my own procedures. The first surgery which I did was an incredible experience, and despite it wasn't so complicated, I feel that I did an excellent work. For that reason, I'm sure about starting oral surgery specialization after I have finished my major.